the other anti-cancer drug, let me discuss about thalidomide. So if you take thalidomide, if you take the major actions of the thalidomide, right, major actions of the thalidomide, number one, first and foremost, it will inhibit the angiogenesis. In the sense, it will inhibit the formation of the new blood vessels. So, inhibition of angiogenesis, that is the formation of the new blood vessels. Next, the other actions of the thalidomide is that, right, it will inhibit the actions of certain the interleukins and as well as the cytokines as well. So remember, this particular thalidomide will also reduce the phagocytosis of the individual. So by reducing the phagocytosis of the individual, it will reduce the immune activity of the individual. Alright, so it reduces phagocytosis. Right, and the third action is it will inhibit, or it will also cause the inhibition of TNF-alpha. Right, it will also cause the inhibition of the TNF-alpha, that is tumor necrosis factor alpha. And what it will do to the production of interleukin 2 is it will cause increased production of interleukin 10. Right, it will cause increased production of interleukin 10. Next, apart from these actions, what this thalidomide will also do is thalidomide will cause the alteration of the adhesion molecule expression. Right, it will also cause alteration of adhesion molecule expression. Next, the other action of the thalidomide is that, remember, thalidomide will also enhance the cell mediated immunity via interaction with the T cells. Now, like we have cell mediated immunity and as well as the humoral immunity. The cell mediated immunity is mediated via T cells, whereas the humoral immunity is mediated by your B cells. So what the thalidomide will do is thalidomide will enhance, right, thalidomide will enhance the cell mediated immunity of the individual via, right, via interaction with T cells. So these are the actions of the thalidomide. Now with this particular actions of the thalidomide, whichever is present, now let me tell you what are the indications for the thalidomide, in the sense in which clinical conditions this particular thalidomide is indicated. So next let me discuss the uses or the indications. Right, let me discuss the uses or the indications. Now if you take this thalidomide, remember thalidomide is indicated in one of the plasma cell disorder, which is nothing but multiple myeloma. So it is indicated for multiple myeloma at initial diagnosis. So multiple myeloma is the disorder of the plasma cells, right, indicated in case of multiple myeloma at initial diagnosis. Next, not only at initial diagnosis, right, not only at initial diagnosis, remember this particular thalidomide is also indicated in case of relapsed multiple myeloma or in case of refractory cases of multiple myeloma. So is also indicated in case of relapsed refractory cases of the multiple myeloma. Next, the other indication is in one of the lepromatous hypersensitivity reaction, that is erythema nodosum leprosum. This particular thalidomide, in case of erythema nodosum leprosum, it will provide dramatic relief, and this is considered as the drug of choice for steroid resistant cases. Usually in case of the erythema nodosum leprosum, we give steroids. So in those clinical disorders where the individual is having steroid resistance, then thalidomide will provide a dramatic relief in this condition. So in case of, right, in case of erythema nodosum leprosum, and this particular thalidomide, it is considered as drug of choice for steroid resistant cases, right, steroid resistant cases. Next, now the other place where there is indication of thalidomide is skin manifestations of SLE. Now what are the skin manifestations of the SLE? Like the individual can have the malar rash over the face, the individual can have discoid rash over the skin, and the individual can have various hypersensitivity reactions. So in case of skin manifestations of SLE, we give thalidomide. So the other indications is in case of skin manifestations of SLE. So these are the indications of the thalidomide. Now let me tell you the adverse effects associated with the thalidomide. Now if you take the major adverse effects of the thalidomide, remember this is one of the teratogenic drug, right? This is one of the teratogenic drug. Now what is the teratogenicity associated with the thalidomide is these individuals, right? If a pregnant mother is taking thalidomide, the fetus will have what is called as the seal limbs, right? The fetus will have what is called as the seal limbs. Next, associated with certain the neurological manifestations in the form of peripheral neuropathy, right? So in these patients with the peripheral neuropathy, they will have paresthesias and as well as dysesthesias of the peripheries. In the sense, they will have tingling or numbness, or they will have burning sensation or pins and needle sensations within the distal part of the extremities, particularly during night. And this thalidomide, it will reduce the gastrointestinal motility of the individual, and wherein the adverse effect of this particular drug will be constipation, right? Next, apart from this, it is associated with certain dermatological manifestation, that is in the form of rash. And this thalidomide, remember, it is associated with the thyroid related disorders as well. Remember, we have many drugs which will cause hypothyroidism. One among the drugs will be your amiodarone, right? And the other group of drugs are your anti-thyroid drugs. The other drugs are like sunitinib. The other drugs are like your thalidomide. So thalidomide is another drug which will cause the hypothyroidism, right? Which will cause the hypothyroidism. And those individuals, whoever are taking this particular thalidomide, they have increased risk of deep vein thrombosis, right? Increased risk of deep vein thrombosis. And remember, this particular deep vein thrombosis is manifested in the form of swelling of the lower limbs, and there will be tenderness of that particular swollen limb. That will be the manifestation of the deep vein thrombosis. So let me shortly revise about the thalidomide. Remember, the major actions of the thalidomide is that it will cause the inhibition of the angiogenesis, and the other actions it includes, it also reduces the phagocytosis of the individual, and it will cause the inhibition of the TNF-alpha activity, and it will cause increased production of interleukin 10. And the other thing is, it will also cause the alteration of the adhesion molecule expression. Then it also increases the cell mediated immunity via interaction with the T cells. And the indications of this particular thalidomide is, it is indicated for multiple myeloma at initial diagnosis. It is also indicated in case of relapsed refractory cases of multiple myeloma. Or it is also the drug of choice in case of steroid resistant cases of erythema, nodosum, leprosum, and indicated in case of skin manifestations of systemic lupus erythematosus. Next, if you take the major adverse effects of these drugs, it is associated with the teratogenicity, peripheral neuropathy, constipation, rash, hypothyroidism, and these individuals, they have increased risk of deep vein thrombosis. Next, now if you take thalidomide, there are certain immunomodulatory derivatives of thalidomide, and the immunomodulatory derivatives of thalidomide, they are called as IMiDs. Now let me discuss the immunomodulatory derivatives. So if you take the immunomodulatory derivatives, right, if you take the immunomodulatory derivatives, so the immunomodulatory derivatives of this particular thalidomide, they are called as IMiDs, right? They are called as IMiDs. Now if you take these IMiDs, that is immunomodulatory derivatives of thalidomide, one of these immunomodulatory derivative of thalidomide, it is called as lenalidomide, right? This is called as lenalidomide. Now if you take this particular lenalidomide, this is approved as the first line therapy for multiple myeloma, right? This is considered to be first line therapy for multiple myeloma. But whenever you are giving this lenalidomide for multiple myeloma, this lenalidomide, it is combined with other drugs like dexamethasone and as well as bortezomib, right? So this lenalidomide, this is combined with dexamethasone, which is a steroid, and the other drug that is called bortezomib, right? Other drug which is called as the bortezomib. Now apart from this particular lenalidomide, remember another group of thalidomide analogues, they are called as 𝐒𝐮𝐻𝐿, right? What does this 𝐒𝐿 stands for? They are called as selective cytokine inhibitory drugs. Okay, so another group of thalidomide analogues, they are called as 𝐒𝐿, right? And what does this 𝐒𝐿 stands for? They are selective cytokine inhibitory drugs, right? Selective cytokine inhibitory drugs. Now remember, this particular thalidomide was used in 1960s, right? And what was the main use of this particular thalidomide in 1960s was, it was being used as a sedative, right? It was being used as the sedative and as well as an anti-emetic drug, right? As well as the anti-emetic drug. So what does this anti-emetic stands for? That is mainly for vomiting and particularly for morning sickness, right? Particularly for the morning sickness, this thalidomide is being used. But this particular thalidomide, which was being used for sedative and as well as anti-emetic effect, this was completely banned. Why it was banned? Because of the teratogenic effect, which is called as the 𝗠𝐞𝐝𝐢𝐜𝐢𝐳. Okay, so this was banned because of its teratogenic effect, right? Because of its teratogenic effect. And what do you mean by the teratogenic effect? It is nothing but when the pregnant female takes this particular drug thalidomide, there will be abnormality in the organ formation within the fetus, right? There will be structural abnormalities within the fetus when the pregnant female takes this drug, that is called as teratogenic effect. So this was banned because of its teratogenic effect. And what was the teratogenic effect? This is called as the 𝗠𝐞𝐝𝐢𝐜𝐢𝐳. Now again it has come again, right? This particular thalidomide, it has come again in the market for use as an anti-cancer drug in case of multiple myeloma and as well as melanoma, right? So again it has come to the market mainly for the use of, right? Mainly for the use of multiple myeloma and as well as melanoma. All right, next. Now remember, you take this, the immunomodulatory derivative, that is lenalidomide. Lenalidomide, it is more potent and it is non-teratogenic derivative. So immunomodulatory derivatives of thalidomide, it is called as IMiDs, and one among that is lenalidomide. What is the advantage of lenalidomide compared to that of your thalidomide is, it is more potent. So this particular drug, lenalidomide, this is more potent. Not only more potent, it is non-teratogenic, in the sense this will not cause, right? This will not cause the 𝗠𝐞𝐝𝐢𝐜𝐢𝐳. Next, the other important thing is, where is this particular lenalidomide used or approved? This lenalidomide, remember, it is approved in the treatment of mantle cell lymphoma, right? Mantle cell lymphoma. Now what is your mantle cell lymphoma, right? These mantle cell lymphomas, they are the tumors which are originating from the white cells. Very particularly mantle cell lymphoma, it is a rare aggressive form of non-Hodgkin's lymphoma, right? It is a rare aggressive form of non-Hodgkin's lymphoma. So this lenalidomide, it has recently been approved for mantle cell lymphoma. And remember, you take this particular thalidomide, not only it will cause teratogenic effect, this thalidomide will also cause sedation and it will also cause constipation in cancer patients, right? Next, the other thing already we have discussed, this thalidomide, it is associated with the peripheral neuropathy. Now what type of peripheral neuropathy is a multiple choice question, right? The peripheral neuropathy can be a motor neuropathy, it can be a sensory neuropathy, or a mixed, that is sensory motor neuropathy. But a point what you should remember is, this thalidomide, it will cause sensory peripheral neuropathy, right? Sensory peripheral neuropathy. Now you take this thalidomide, it has two enantiomers, right? The two enantiomers of thalidomide are present, but these are interconvertible in the body, therefore racemic mixture is used. So the two enantiomers of thalidomide are, right, the two enantiomers of this particular thalidomide, they are R and as well as S. Now the point comes, what do you mean by the enantiomers? Remember, the enantiomers are two molecules which are mirror images of each other structurally. That is nothing but enantiomers, right? Enantiomers, they are two molecules which are mirror images of each other structurally, that is called enantiomers. And there are two enantiomers of thalidomide, that is R and as well as S, right? And both of these enantiomers, they are interconvertible in the body, right? Both of them, they are interconvertible in the body. Now, because they are interconvertible in the body, therefore racemic mixture is used. Now what do you mean by the word racemic mixture? It is a mixture of two enantiomers, right? So therefore the racemic mixture is used. Next, now remember, there is one newer thalidomide analog, right? This can be asked as a multiple choice question. The newer thalidomide analog, this is called as pomalidomide. Pomalidomide, remember, it is a newer thalidomide analog. Alright, pomalidomide, it is a newer thalidomide analog. So this completes the discussion of thalidomide and as well as its derivatives. So let me shortly revise the derivatives. Remember, if you take the immunomodulatory derivatives of thalidomide, these immunomodulatory derivatives of thalidomide, they are called as imids. Now, one of the immunomodulatory derivative, it is nothing but your lenalidomide. Lenalidomide, it is approved as a first line therapy for multiple myeloma with dexamethasone and as well as bortezomib. And another group of thalidomide analogs, they are called as 𝐒𝐮𝐬𝐜𝐿, that is selective cytokine inhibitory drugs. And this drug, that is thalidomide, was used in 1960s as a sedative and anti-emetic drug, particularly for morning sickness. But this drug was banned because of teratogenic effects, that is phocomelia. Now remember, now this thalidomide is again come into the market for use as an anti-cancer drug in multiple myeloma and as well as in case of melanoma. Next, you take this particular lenalidomide. Lenalidomide, it is more potent and non-teratogenic derivative. And this particular drug, remember, this is also approved for mantle cell lymphoma. And the other important point regarding thalidomide, what you should remember is, this thalidomide most commonly causes sedation and constipation in cancer patients. And not only that, this will cause the sensory peripheral neuropathy. And there are two enantiomers of thalidomide, that is R and S. And these are present, but both of them, they are interconvertible in the body. Therefore, the racemic mixture is used. Next, now there is one of the newer thalidomide analog, that is called as pomalidomide. So this is completely about your thalidomide and as well as its derivatives.